In this section, we will discuss diabetes mellitus. What is diabetes mellitus? Well, it could be too much sugar floating around in the blood, which is called hyperglycemia, or the pancreas can't produce enough insulin, or a cell in the body have become resistant to insulin. After reviewing the videos, let's dive a little bit deeper into discussing the two main types of diabetes mellitus. You have type 1, and diabetes mellitus type 1 is the most severe form of diabetes in which not enough insulin is produced by the body. The lack of insulin results in high blood sugar levels caused by insulin deficiency following beta cell destruction, inability to produce insulin, and technically these patients become insulin dependent. The other type of diabetes mellitus is type 2. This could be caused by a couple of factors. This could be caused by a progressive insulin resistance, a defective insulin production, and basically overall just a type of insulin resistance that the cells have. So the glucose stays into the blood. So how is diabetes mellitus diagnosed? Usually from a fasting plasma glucose. If a person's fasting plasma glucose is 126 milligrams per deciliter or higher over 2 separate occasions. If the hemoglobin A1C is 6.5% or higher on 2 separate occasions, or they can use an oral glucose tolerance test. With this 2-hour post oral glucose tolerance test, the glucose levels are 200 milligrams per deciliter or higher. So again, have to occur on 2 occasions. If I really wanted to dive into the difference between the treatment for type 1 and type 2 diabetes, think about this. With type 1 diabetes, there was some type of autoimmune disorder, something that attacked the beta cells of the pancreas. So in order for a person with type 1 diabetes to survive, the only thing they can bring back into their body to survive is insulin. Oral medications does not work with type 1 diabetes because the pancreas, the beta cells in the pancreas does not produce insulin. So in order for them to survive, they got to have exogenous insulin put back in. With type 2 diabetes mellitus, a couple of things can occur. Lifestyle changes, exercising, dieting. Those are some things. Losing weight, weight control, smoking cessation. Those things can help with type 2 diabetes mellitus. Also with type 1 and medications. So type 2 diabetes, remember, their body may not be making enough insulin, or their cells are resistant for the insulin to come into the cells. So they can have oral medications and they can have insulin to help with pushing the insulin, like that transporter to push the glucose into the cells. When we look at symptoms and complications of diabetes mellitus in general for type 1 and type 2, some of the symptoms are excessive urine, infection, thirst, fatigue, hunger, vision changes. Sometimes you'll hear of the 3 Ps: polyuria, polydipsia, polyphagia. You may hear those terminology used. It's the 3 Ps. They have increased thirst, increased urine, increased hunger. And then some of the complications that you'll see: neuropathy, nerve damage, nephropathy, kidney damage. The risk of heart disease, heart attack, and strokes are greatly increased with diabetes. Includes coronary artery disease with chest pain, and atherosclerosis, which is narrowing of the arteries. Possibly diabetic retinopathy, damaging to the blood vessels of the retina in the eye, which can cause vision loss. And the risk of developing cataracts or glaucoma, which is also associated with diabetes. Hearing loss is a common complication of diabetes. Depression is also common. with diabetes, and even the risk of developing dementia, such as Alzheimer's disorders, is greatly increased with type 2 diabetes. So other complications could be infections or sores that don't heal, especially in the foot, may be caused due to nerve damage or poor circulation. This concludes the short module on the overview of diabetes mellitus.